Besides the normal ticks and fleas, we are seeing lots of black flies, and that means more bug bites for our pets. We have a veterinarian with us this morning, Tanya Schulte from Secondhand Hounds. Thanks so much for coming in.
Thanks for having me.
I just came from the cabin in Spooner, Wisconsin, and I can tell you that the bugs, they are out up there for sure. And we really forget about protecting our pets, especially dogs. So what should we think about when it comes to black flies in particular?
Black flies are something we commonly see in May and June. And it's something that quite frequently what will happen is these dogs will be out in the yard and these black flies will bite their ventrum or their underside in the fairly hairless portions. And it'll create these red, round, circular, or bullseye-looking lesions. And they're something that become alarming to these owners because they see these bullseye-looking lesions and think their dog's been bitten by a tick and they've got Lyme disease. When in all actuality, dogs don't get that bullseye-looking lesion like humans do from Lyme disease. So they're usually fairly asymptomatic. They might have a little bit of some itching at that particular site, but that's it. On average, they will resolve on their own in 24 to 72 hours. But a big thing to consider is that if, say, for example, insect bites are a problem, you could actually use a certain type of flea and tick medication that actually has a repellent property to it. So Canine Advantix 2 or Vectra 3D actually also offer repellents against mosquitoes, gnats, biting flies, certain types of mites and lice.
Just like we need repellents, so do the dogs.
Yes.
And also, I guess it never dawned on me, with bee stings, which we know dogs can get stung, they can also be allergic.
Correct, yes. So that's a good way to potentially consider that you need to call your veterinarian. If you're up at the cabin and a dog has gotten bitten or stung by something and all of a sudden they start to have some facial edema or swelling, if their lips get really thick and puffy, or they get really a lot of swelling around their eyelids, that's a time frame when you need to call your local vet to have them evaluated.
And what should we look for when it comes to tick and flea treatments?
As far as the treatments go, I would recommend something that like Bravecto or NexGard or the Canine Advantix or potentially Vectra to be able to help with preventing against these fleas and ticks from biting them through the course of the season.
And of course, if you have any questions on that, just ask your vet. But also remember that when you head up to the cabin, it can be several hours away. If you need a vet, an emergency, you need to have one on hand, correct?
Correct. Something that you could always do if, say, for example, your dog was having some type of an allergic reaction is to give them Benadryl. So kind of a rule of thumb is approximately 1 milligram per pound of dog. Okay. So if Benadryl tablets come in 25 milligram tablets, a 100-pound dog could receive 4 tablets of Benadryl, and that's a good, safe, effective thing to be able to do before you can get to that vet.
Okay, awesome. Well, Tanya, thank you so much for coming in.